Base factors are the new hype when it comes to doing statistics in psychology or in cognitive science. Base factors in the last 10 years have converted a lot of people, and the reason for this is that they promise that they can provide evidence for a hypothesis. The traditional way is basically just you go with the hypothesis until it is disproven, and you don't really, you always consider the hypothesis provisional. It's not, you don't have evidence for the hypothesis, you just didn't have reason to reject the hypothesis yet. One famous example is the black swan. So for a long time, people only saw white swans, and they went with the hypothesis that all swans are white. That's your hypothesis. And the traditional way is to say we will wait until we see a black swan and then we reject this hypothesis. But the Bayesian statistics promise to provide evidence for the fact that there are actually only white swans. Of course, if you encounter a black swan, Bayesian statistics would also confirm the hypothesis that there are black swans. But if you have for a long time only seen white swans, you can calculate the evidence, the probability that actually there are only white swans. And that's interesting, but it comes at a price. And I think I have a good visualization, a good metaphor, what the problem with this approach is, what the problem with providing evidence for a hypothesis is. And one of these problems is actually known as the catch-up phenomenon, best described in Tindaro and Kears. And even though they don't call it catch-up phenomenon, they have a nice visualization here. So suppose you have a medication and you constructed it, and in reality, but you don't know that yet, in reality, your medication has a small effect. So for example, you invented something that has a small improvement in headaches. You don't know yet whether this actually has a small improvement or actually does not work at all. So you have to gather evidence. So what you do is you gather a lot of patients. That's our sample size. So maybe 1, maybe 10, maybe 100 or more participants who take the medication and tell you whether their headache improved or not, right? And now you do Bayesian statistics to either prove the hypothesis that your medication works or the hypothesis that your medication does not work. And you calculate base factors. Here, base factor 0, 1 would indicate if it's going up, evidence for the fact that your medication does not work. And if it goes down to 0, evidence for the hypothesis that your medication does indeed work. And if you start with a small sample of only 1 or a couple of participants, base factors around the value 1 show we have no idea, we don't know yet. We have only seen a couple of participants or patients in your study. We don't know whether your medication works or not. As you increase the sample size, base factors will tell you there is evidence that your medication does not work. That would be consistent with the idea that you've seen a lot of white swans, and now we have evidence, we are convinced that there are only white swans. But then if you increase your sample size, if you get more patients, at some point the base factors will tell you, well, now we are changing our mind. Now we are convinced that your medication does indeed work. It's a small effect, but it does indeed work. That would be the same thing as seeing a lot of swans, and at some point you see a black swan and then you are convinced of the opposite hypothesis. So there's a kind of switching, right? When in the traditional approach you go with one hypothesis, you say, okay, it's provisionary. We don't know whether there are only white swans, but that's our hypothesis for now until it is disproven. Base factors tell you, yeah, we are convinced there are only white swans, and that might have to change at some point. So this conviction that there are only white swans or that there is no effect of your medication, that in my eyes is a little bit of a danger of base factors. And I show you one visualization of why or what this intuitively means. So suppose I tell you I either have one line in this image or I have 2 lines. I will next show you one of these 2 images. I picked one. I'm not telling you which one yet, but I've picked one and I've blurred it. So we might not exactly see which one it is, but we will have to think about, or that's the task. You have to decide which one it is. So first I put a lot of blur that would be consistent with the idea of having few participants, not a lot of knowledge. And what you here would say is we don't know. We don't know whether it was 1 line blurred or 2 lines blurred. Now I decrease the blur, and what it seems to be now is maybe 1 line blurred because you don't see 2 separate things. It's just 1 line that's a little bit wider because of the blur. And you would be a little bit convinced of the null hypothesis that you only have 1 line convinced of the idea that there are only white swans, or convinced of the idea that your headache medication does not work at all. But the more evidence you gather, the less blur here, the more you see that there are actually two lines, that your medication does work a little bit, that there are occasional black swans. And that, in my eyes, is a visualization of this catch-up phenomenon. And what I think is that this is problematic. You should not be convinced of the wrong hypothesis in the first place. Ideally, you go with a hypothesis and reject it at some point, basically acknowledging that you don't really know. You should not be certain that you know that there's only one line in this image, that you know that there are only white swans, that you know that your medication does not work. You should just always take the position of, we have this hypothesis, we don't know yet, we might reject it at some point, but we can't be certain that it's this. And Bayes factors promising that there's evidence for confirming a hypothesis is, for this reason, in my eyes, a little bit problematic.